Okay, hello Head Start and early Head Start community. So great to see so many of you logged in today for this special discussion around SNAP eligibility with some wonderful national partners of ours who also have a lot of local and state reach. The Food Research and Action Center, FRAC. I went ahead and put their website here on the title slide. Highly encourage you to, during this webinar, if you need a break or post, to really check out all the great resources that FRAC has. My name is Kent Mitchell. I am the Senior Director of State Affairs, and it's my honor to be working with the whole NHSA team to make sure that this SNAP eligibility change, real progress for our community, is implemented well and that we're supporting you as a field. So excited to connect you with some leading experts nationally, really the leading experts on SNAP. I just want to take a moment to acknowledge in the upper right-hand corner this amazing photo. Did not plan it, but let's give ourselves a high five too, because just like this young child is enjoying a nutritious meal with his teacher or aide at Head Start, man, we've accomplished something great with this SNAP change. Implementation is now the phase we're in, but it's always important to take stock and remember it took a long time to get here. And it's your advocacy, our collective advocacy, that made all of this possible. So let's go ahead and get started. All of you should know NHSA, but we are the national association that really strives to be that untiring voice until every vulnerable child is served with the Head Start model of success for the whole child, the whole family, and the community. Again, a huge part of how we do that is advocacy, and that's all of us together. And today, again, we're celebrating the advocacy win and moving toward implementation. And hopefully some of you have been on past webinars around that already with this SNAP change. Our mission, again, is to coalesce, inspire, and support the Head Start field as the leader in early childhood development and education. So again, so great to have you. You all make that mission possible. We're honored to serve you. The goals for today's session: one, we're just going to spend 5 to 7 minutes at the top of the hour briefly reviewing some of the SNAP resources that NHSA has put out. As you all know, the Office of Head Start has put out quite a bit of material as well, including a very powerful and important FAQ that they've done. But we want to highlight some of our resources to date. Second, the heart of today is really deepening your own knowledge and understanding of SNAP to support effective implementation in your community. Again, we're so honored to have a senior leader from FRAC, Ellen Bollinger, here to lend her expertise, and they've just been tremendous partners. They're first folks we reached out to when this change happened. And then finally, we want to answer your questions. So I hope you're going to be active in the chat during and throughout this webinar. I want to highly encourage that. We're going to have ample time for questions, but only if we get questions. So as things are coming up, just go ahead and put them in the chat. And we'll make sure to monitor that. We have a couple staff members available to do that. I will be doing that as well. So the most you're going to get out of this is if you're deeply engaged, so highly encourage that. So I just want to take a minute again to recenter us because we're moving so fast all the time in Head Start and early Head Start. But why is this SNAP information memorandum, this policy change, so important? We really key in on 3 things again. One is that it eases enrollment for already eligible families. That's really number one, right? That it relieves this tremendous burden on families with paperwork, complexity, and makes it easier for already stressed families to access this game-changing program of Head Start, early Head Start. Second, it does open up access to Head Start, early Head Start for more eligible children if there are slots, if there's availability. And so we know that's a great thing as well. SNAP has higher income eligibility. And so SNAP is a much larger program overall than Head Start in terms of numbers served. So in some states that will be very important. In some states it will be less important, but we always note that more eligible kids are now eligible for Head Start, early Head Start. And then finally, the partnership opportunities, the opportunities for your local programs, your programs to develop new partnerships with local agencies that work on food insecurity or human service issues, state partnerships. Our state associations are actively developing with SNAP agencies and states. So anytime Head Start can partner with new audiences is a win for kids, And I love this photo at the right. I mean, this kid is contented. If we do the right work here, if we really implement this SNAP IM, it's going to be a great benefit to kids like this, more easier enrollment, more eligible kids, and new partnerships as well. So I just want to stress that number one point about relieving the burden on families. I just pulled a little bit of context and text from the IM again, where they really focused, OHS really focused on the justification around relieving that paperwork burden, that income eligibility burden for families and for grantees, for your staff as well, to know that it's easier to prove eligibility and enroll families. They mentioned the use of the single document. Our speaker today is going to talk about the 3 single documents and how those support eligibility, easy eligibility, ease of eligibility. And then finally, the end goal, right? It's improving access for eligible families. So really wanted to lean into OHS's interpretation and vision for this change as well. And we share that vision, this easing the burden on already stressed families and programs. With that, I want to mention a few resources that we have already put out. I'm just going to list them here, and then we're going to go deeper into the toolkit. So my colleague Keisha McCrae is here to go into the toolkit in a minute. That's to support programs and their implementation. We did a concurrent webinar that Keisha led with a number of program leaders around how to use the toolkit, some of the decisions they made, et cetera. And we do have an easy to read blog explaining the SNAP change. It's really meant for any audience. It can be anyone who doesn't even know much about Head Start or early Head Start or why this change matters. And so that's something you can use, particularly with community partners or others who might be curious about this, or you're reaching out to develop new partnerships. So with that, I also want to bring on my colleague, Keisha. Keisha, I'm going to go ahead and click on the toolkit if you'd be able to walk our audience through that a little bit.
Sure. Thank you so much, Kent. Good afternoon, everyone. As Kent mentioned, this is an honor to go through the toolkit and definitely have FRAC on today to provide additional insight. And so our toolkit was called Snapping Our Fingers for SNAP. We also had a webinar as well, and both will be available in the chat. So the beginning of the toolkit kind of gives a framework, gives us some background, what Kent just went over, the IM, and then the connection between Head Start and SNAP. And then what is the SNAP toolkit? And we kind of get into what is SNAP, and you'll learn more about that today if you like to know more. And so we reviewed some key terms. And so the Head Start Act, in talking about the inclusion of public assistance and now having SNAP be added to that, we talked about definitely categorically eligible, or what is categorical eligible. In terms of the questions around that happened during our Q&A session. I really encourage you all to go back and review the recording if you have not, to see some of the amazing Q&A that was led by Ann Linehan. And then we have an implementation checklist. The implementation checklist is really a way for programs to kind of go through each of these steps and say, okay, this is what I need to do for my particular program. Starting off with the community assessment, which is really a leading factor in how we implement the SNAP eligibility piece within individualized programs. Kent, if you can go down further, and each of these checklist items, you'll see that it really is individualized to your particular program, but some of those things you'll definitely see as a result of following your current policies and procedures and performance standards, the Head Start Act, and then the updated IM. There's an example of a selection criteria. There's an example of a staff announcement for letting your staff know what has taken place and the updates. There's also an announcement for existing community partners to also let them know that now we will be accepting SNAP in terms of making families or having families be eligible for Head Start. There are some examples of media that can be used as well. These are all things available in our current toolkit. I really strongly suggest, each of you reviewing that toolkit and the webinar as well. And then there are some additional resources that we've added at the end of the toolkit that can help with the implementation. Thank you so much, Kent.
Yes, thank you so much. So I hope you all will check that out. Great resources there. Without further delay, I want to turn our webinar over to Ellen Bollinger with FRAC. Welcome, Ellen. Please give her a warm Head Start welcome in the chat. She is the SNAP Director for the Food Research Action Center. She's led FRAC's efforts to bolster SNAP and particularly to serve working families, legal immigrants, and victims of disasters. Ellen has a BA in American Studies from Smith College, a master's in legislative affairs from George Washington University, and a JD magna cum laude from American University's Washington College of Law, so very distinguished speaker today. Her prior positions include serving as director of the nonprofit National Committee for Full Employment, as well as a practicing attorney with the Washington, D.C. law firm of Ross, Dixon, and Masbach. So Ellen, welcome today. We're so excited to have you.
Kent, thank you so much to you, to Keisha, and the entire National Head Start Association team for what you do every day. It's so important what you're doing to help young children get off to a strong and early start and be able to thrive. And it's really a tremendous accomplishment to have gotten this advance in Head Start eligibility with SNAP as one of the pathways into it. Next slide, please. You've covered some of these facts. I just wanted to ground people a little bit in case they are not aware of the scope of SNAP, which of course is the Supplemental Nutrition Assistance Program, formerly called food stamps. It may go by a different name in your state. It's technically federally the SNAP, but in some states it might be called Cal Fresh. That's what they would call it in California, or Three Squares Vermont. Sometimes it might be called Food Assistance Program, but the rules are, the eligibility rules are very similar state to state. Across the country in March of 2022, which is the latest time that we have national data, the program served over 41 million individuals. And we know from prior years where we have more access to demographic information that there's a very significant cohort of preschool children in that. In fiscal year 2019, more than 3 million children ages 2 to 4 were in SNAP households. The SNAP program provides benefits for food purchases. They do it on an electronic benefit transfer card, EBT, which is going to come up later when you're talking about ways to make it easier to process the eligibility of SNAP households. And those SNAP households use the cards at authorized SNAP retailers. They may be farmers markets, they may be military commissaries. They're often very large grocery stores. Sometimes though, they're the corner store. And during COVID, the country has experienced so much change with respect to what we do remotely that now in most states, most SNAP households have some ability to use their SNAP benefits for online purchase. Each dollar of the SNAP benefits during a downturn, and this of course has been a very disrupted time, generates between $1.50 and $1.80 in economic activity. So it's a program that has a very large footprint. It touches a lot of lives. It also touches a lot of the economy, and it operates on the regular rails of commerce. And when I say that, I mean that EBT processing system, as well as the regular grocery retail market. Next slide, please. So SNAP is targeted to high need households. Like Head Start and Early Head Start, it's an anti-poverty program. And income eligibility is the most important determinant of eligibility that the program has. I think you've heard already from Kent that typically the household will have under 100% of the poverty level income. There are two tests for income within SNAP. One you often hear about is the 130% test. That's a gross income test. States are allowed, if they want, to raise that up to 200% of poverty. Still a very lowest lower type income household, even with the higher gross income. But in addition to the gross income test, the household also has to demonstrate net income at a poverty level of 100% of the federal poverty limit. That's because SNAP recognizes, as a matter of public policy, that SNAP households often have money going out of their household budget for other basics, particularly childcare, shelter costs, utility costs. And if those dollars are going for those other basics, they're not available to purchase food. So SNAP considers where a household is with respect to what's its net income after a few of the deductions that they get credit for in their SNAP determination. As a result, what you see is usually a very low income population participating in SNAP. And in fact, the average gross cash income for SNAP households in fiscal year 2019 was under $900 a month for that whole household. That was the gross income before any of those deductions. So again, it's a high need population. We're so excited to have them be able to be eligible for additional services because they certainly are coping with a lot, stretching a lot, and a lot of them have young children. So next slide, please. SNAP benefits are modest. We think SNAP is the most important of the nation's anti-hunger programs. It's the largest in scope. It touches the most people. It's a lifeline for them, but it's typically not enough to meet their food needs, let alone all the other needs that families have. In March of 2022, the average SNAP allotment, and SNAP allotments vary according to household size and how high or low the income is. So once you've determined eligibility, what amount a household will get is going to vary depending again on just how poor they are and how many people are in the household. But for the average individual in SNAP, their average allotment was only $7.35 a person a day. That is higher than it normally is, in part because during COVID-19, most states have been able to access federal emergency relief that has meant higher SNAP benefits since the beginning of COVID-19. They're not in place everywhere. They will end, at least under current law, they're going to end whenever the pandemic health emergency ends. And at that point, the SNAP household is going to get an average per person per day allotment of only $5.50 a day. I say that because I think it puts in perspective for you, which as you're thinking about need, what the needs are in a SNAP household. And of course, you're going to have many criteria once you've determined that they're potentially eligible for Head Start, and you have your other grading criteria. Just keep in mind, these are very needy households with very meager benefits. And during this period of time that you're able to connect them with Head Start, they may be undergoing a hunger cliff, because when that pandemic health emergency declaration ends, not only will the average amount per person per day go down, but most SNAP households in this country are projected to lose $82 a person a month in SNAP benefits. That's a lot of grocery money. It's going to be, a real struggle for them. We know that they're struggling now. Typically, SNAP households before COVID, during COVID, and probably after COVID, often need to turn to other ways to meet their entire food budget. SNAP only gets them partway through the month. That's why they often are turning to food banks and their distributing agencies, food pantries and others, to try to supplement the SNAP benefits. So again, these are very needy households. They're struggling with a lot, and anything you can do to help them get more for their family in terms of opportunities for those children to thrive will be very impactful for them. I think it's pretty clear from the data and also from what we hear from around the country. Next slide, please.
Ellen, if you don't mind, I'm going to pause for a minute and ask a question of you. Courtney, could you go back 2 slides actually to the net income slide, the 2 previous slides? So there was a question in the chat I thought we'd try to address right now, which is Joyce asked, how do we find out if we can take the net income and not the gross? I'm not sure if that question makes sense. We can ask her to elaborate if so, but
You know, I agree with the question in the sense that you would think it's intuitive that we would only care about net income, but the federal law is such that you have to look at the gross income as well. You have to look at both. In my view, it's the net income that's the real clincher. The gross income is more of a gateway. You know, you're basically out of the ability to qualify for SNAP, even if your expenses are very, very high, which they could be. You could net out, but if you're over whatever the gross income test is in the state, there are some states where it's 130%. Many states have gone up to at least 165% or 185% or 200% of poverty. Even, we know those households are struggling. It's why I think in the United Way world, we hear so much about Alice families, if that's a familiar concept to many of you. We know that low wages are very tough for a lot of American families, and that it's a struggle, and that people, even if they're working and they're earning some money, and it might even be more than 200% of the federal poverty level, they likely are still struggling with very high costs for other basics. So again, I appreciate the question. I appreciate the sentiment. Unfortunately, federal policy isn't quite there, and you look at both.
and I think one of the thrusts of some of these questions is, well, it's almost like folks are maybe thinking they might have to really be experts in eligibility for SNAP. And I think that's really not the case with this policy. That would be impossible. That's why people like Ellen and other experts are there, but not Head Start. Head Start, we are simply going to look at, are they in SNAP? Someone else has made that determination and verify. Isn't that true, Ellen? And that's kind of
absolutely. Yeah, absolutely. And in addition to the fact that you will be getting this corroboration, the ways you'll get it are, again, because they've been determined by the SNAP agency.
Yeah.
They'll have an EBT card. It'll have a SNAP ID number on it. That is proof that they're getting SNAP. And that is what I believe the HHSIM has made clear, that that's one of the key ways that you're going to be able to go forward if they've got that SNAP EBT card. They also have referenced the copy of notice of approval.
Yeah.
So typically when a household is approved for SNAP benefits, and it could be for the first time, or it could be later on, they will be getting a notice from the state agency that'll be a very clear indicator of the fact that they're getting SNAP. Now, there may be some other documentation of benefits and eligibility from the SNAP agency. And in a later slide, we talk a little bit about how there might be some pathways for agreements and better cooperation between Head Start and the SNAP agency. But absolutely, you're going to be able to rely on these. And you'll also have opportunities as the Head Start community to partner with hunger groups who also are expert on SNAP. And so to the extent that you have questions that arise for you along the way, they also can play a role in helping you navigate.
Okay. Well, let's go ahead and have you do this slide, because these are the 3 forms of documentation. There may be others, but I think helping people understand from your expert view, what do these look like? What are these? That will help answer some of these questions, I think.
Right. So I put a little picture of what EBT cards across the country might look like. That's from USDA's website. It's a little hard to see, but what you'll see with an EBT card is that it may be called something different in your state. So one thing you're going to want to be familiar with is, what do they call the card in your state? It could be called CalFresh. It could be, in Illinois, I think it's called the Link card. It may have more than one benefit on the card, but it will have a SNAP ID number if it's a SNAP card. So once you become familiar with what color, what design of your EBT card is, it should be very clear to you that, oh yeah, that's a SNAP EBT card. And just make sure you look at that SNAP ID number. The notices of approval are very typical government forms. SNAP is a federal program with a lot of very particular rules about what information customers have to get. So there's certain parameters to them in terms of the legal language that has to be followed. And so unfortunately, it often looks like, the typical government form that sometimes can be a little daunting to an individual, but it should be very recognizable to you. It will have the state agency information on it. And it's a pretty easy document, I think, to understand. Other documents there are a lot of notices that go out in SNAP. A lot of different notices, things that might have to do with a new rule change or something that would also indicate that that is a SNAP recipient, because that's why they're getting the particular notice. Again, it could be of a change in benefits. It could be something to do with a change in their issuance schedule. It could be a notice of some other kind of thing that's changed in the program. It may be a change in the hours that things are available. It could even be for a very positive reason, which is increasingly the case in SNAP these days, for an improvement in customer service and tools that the SNAP agency may be making available. Things like being able to use your cell phone or smartphone to upload your documents. It could be that kind of very friendly. But I would think that would be the kind of document that would be, anything that's like a notice. Notice of approval is the easiest one to talk about, because that one everybody will get at some point. But there will be other things with ongoing cases that could easily suffice. I would say the most important thing in SNAP with verification on the SNAP side, which is not your side, but just so you're aware, we stress all the time in SNAP that alternative measures or alternative ways to verify are just that. They're alternative. And I tried to maybe I should have capitalized the ors, because these are alternatives that are available to you and that should make it easier for the customer, for that household, and should make it easier also on your end. So don't feel just because in that IM, they list the various ways that they are asking you to look for more than one way to verify.
Yeah, good point.
All you need is one. And sometimes, when people see lists, it can be a little confusing sometimes. We know sometimes in SNAP world anyway, that, oh, gee, do you want all that? No, all you need is one.
So we had another question about the SNAP ID. Are all cards going to have that SNAP ID, or would these other notices have the SNAP ID on them? Could you just give us a flavor of that?
So, well, I would say that, yes, look for the SNAP ID on the EBT card.
Okay.
You may or may not see a case number or a SNAP number on the notice, if it's a notice of approval, but there will be enough indicators on that piece of paper that you're looking at an official document. It'll have their name, their address. It'll be pretty clear that that's a SNAP document. But look for that SNAP ID number, and I believe that's what the IM is specifying. You're looking for an EBT card with the SNAP ID.
Great. So yeah, and Christine commented, we were told not to use the card because it is not dated. I know this question has come up and perhaps there's no easy answer. I will give one of my takes, which is that part of the reason we wanted Ellen to come on this call and share the slide she started with is that you need to have confidence that if a family's on SNAP, they are low income, probably severely low income, and qualify through the SNAP portal. And they may qualify just right. If they weren't on SNAP, they'd qualify through the income portal. So I don't know if there's an easy answer for this, Ellen, but perhaps we could just have a little colloquy here about this question of folks rolling off benefits and programs being worried that they are using an old card. Do you have a perspective or questions at least we should be thinking about?
No, but I would say, Kent, that it seems pretty clear that HHS is aware that SNAP is not a permanent benefit, but on the other hand, it can be an ongoing benefit. And I think they must recognize that because it's a program where it doesn't terminate necessarily, people might get recertified, but it doesn't make sense in SNAP world to have a date on the card, like a termination date. That would not be useful for SNAP. And so I I will defer to you and HHS as implementation continues, and as you know, they may have further explanations for this, but they were very clear in their IM that you should be looking for an EBT card with the SNAP ID number, and they didn't seem to have any hesitation
Yeah.
about making that a very good pathway for you.
Yeah, and a couple of folks in the call, I see Nalamar said, hey, if families print out their balance SNAP from the EBT website, might that be counted? I think that's a creative, interesting way to look at working with families to prove eligibility through SNAP. Maureen wrote, our families can request that a current SNAP printout be faxed over to us. Makes me a little nervous to even see the word fax in this day and age, but I understand and appreciate that thought there. So yeah, I think there's just a lot of iterations folks are putting in the chat here, understanding that the variation in states could be significant, right, with the cards, et cetera. One really important thing, and something we didn't quite cover at the top of the call, but we've talked a lot with FRAC about, is just for everyone to know SNAP is an entitlement, right? So unlike Head Start, where it's essentially limited by available funding, if a family qualifies for SNAP, they have a right to SNAP benefits. And so that makes that program a little bit different, larger in scale, and I think is important for folks to know that you have a state agency, right, implementing essentially an entitlement program in their state. And we'll get into some of that too. Ellen, let's go on to the next couple slides and then we'll circle back to questions.
Yep. So actually, Kent, that is an interesting lead in to closing SNAP gaps, because as you say, SNAP is an entitlement. But does that mean that everybody who is eligible for SNAP is participating? Unfortunately, no.
Right.
And it's not always because they've chosen not to. It's often because they don't know they're eligible, or because of the kinds of things that you know are true in all of our programs, which is sometimes the hurdle of getting through the eligibility system is daunting. They may not know they're eligible. They may not know the first place to start. They may not be able to put together all the paperwork. They may run into inappropriate handling in some cases on the SNAP side. And for that reason, those variety of reasons, nearly 1 in 5 eligible people for SNAP doesn't get the benefit. That is a significant SNAP gap.
Yeah.
Now, those gaps vary widely. They vary widely from state to state. It's a little surprising in some respects because it's federally funded. 100% of a SNAP benefit is provided by the federal government. So one would think that the states all have the same, reason to make sure that their residents are able to pull in and they bring in that money to the state as any other state. But there are gaps. They do vary widely. I've put in the slide. It's a little hard to see, but there is information where you'll be able to see in your state, how sizable is the gap. But the other link that I've put in here, and it's available on our FRAC website, and thanks, Ken, for earlier giving them the frac.org.
Yeah.
Within our SNAP postings, we do have a section called Closing SNAP Gaps, because our folks are, just as you're concerned about making sure that you're reaching as many, especially with the funding that you do have, reaching as many of the neediest people as you possibly can, the families that need your services the most. We're concerned, and our allies are concerned about closing those gaps in SNAP and making sure that we get SNAP to those households that do qualify for it. And those strategies range from, getting the word out, doing more education and outreach. We typically partner with advocates across the country who are navigators or outreach workers. They're application assisters. They're often working with their state agencies to help people walk them through what it's like to navigate that eligibility system. There are a variety of reasons. Some places do a better job of just processing than some other states. And so our reports from a variety of cities and states outline what some of the most important strategies are to close that gap. Next slide, please. And again, that is why SNAP stakeholders value outreach and partnerships, because they're trying to make sure that the customers that they care about, those SNAP eligible families, are getting SNAP, making sure more of them get SNAP, but they also partner often in making sure that they can make referrals to other services, in recognizing that these customers have needs that go way beyond food and way beyond the ability of SNAP to meet that need. We've done a series of webinars during COVID-19 with a company called Propel. And Propel has an app called Providers. Providers reaches 5 million SNAP households. That's the number of SNAP households that have decided to download that free app and use it to check their SNAP balances. And I raised that because during COVID-19, Propel was surveying its customers every month to find out what they were experiencing. And they, of course, were experiencing a lot of hardship during COVID-19, but it wasn't only on the food side. They were, they were reporting all kinds of problems with affording childcare, with affording access to good housing, affording the ability to pay rent. Many of them were facing eviction, difficulties keeping up with utility payments. So I think one of the things that you'll find if you do end up getting into the SNAP outreach and partnership world is there's a keen awareness not only of the importance of SNAP for these families, but of other services, and trying to make sure that they get all that they're entitled to. Now, again, SNAP's an entitlement. Not all programs have an entitlement funding stream. We recognize there are some limitations, but to the extent that the SNAP advocates can help make sure those families get as many of the services as they need and are eligible for, that's a high priority for them. I mentioned the outreach projects in particular because these may give you very concrete avenues to partner with your SNAP state agency and with your anti-hunger partners in your states. And that is that in addition to paying for 100% of the SNAP benefit that's on the card, the food benefit, USDA, which is the agency responsible for SNAP, will reimburse states for half of the cost of state SNAP outreach projects. And those projects typically are done with partners, often from the food bank world, sometimes from CAP agencies, sometimes from the local areas on agencies on aging, sometimes they're with other anti-hunger organizations. They may be with a food pantry, but those can be very impactful projects. Sometimes those are funded for the state through community grants, whether those are philanthropic dollars or food banks that bring their dollars to the table. But those are important projects and important ways of helping eligible people connect with the benefits they need. Annual state SNAP outreach plans are submitted every year to USDA's Food and Nutrition Service, FNS. That's the part that operates SNAP. They're due every year by August 15th. So I mentioned that to you because your state is probably already drafting their annual plan for what is going to go into operation and get funded starting October 1. There's still time to connect with them, see whether there might be opportunities for Head Start agencies to help reach out to SNAP families, see what the opportunities might be, given those connections, to have greater awareness also about the fact that the SNAP enrolled person might then be able to be connected with Head Start. And so this is a good time to be thinking about that. Those state plans typically can be amended after they're submitted in August, but it's so much easier and better, as with most things in life, to get in before that initial deadline and not have to worry about trying to amend it. But whether or not you connect directly with the outreach plan, these can be a good source of support for you, I think, and you would have an audience that's very knowledgeable about SNAP, but also interested in what else those families need. And next slide. So this is just a slide. My colleague, Jerry Henchy, whom I should have mentioned to begin with, Jerry runs our preschool work, nutrition work at SNAP. And I think, Kent, that's one of the reasons we have that very strong relationship with you as an organization. And she prepared this a little earlier when she presented at your annual meeting. And it's just a reminder of important ways that agencies, whether they're on the Head Start side, on the SNAP side, can be thinking about going forward together and different opportunities for partnering. Again, you've got some very simple ways of verifying the eligibility with that card, with the notice of approval. But you may find that there are also additional avenues, whether it's sharing data, having some matching information, again, with the appropriate privacy policies attendant to it. Certainly conducting outreach and awareness. And I was so delighted to hear on your recent webinar, Kent, that, and I think Keisha ran that one, that one of your partners on the CAP side in Oklahoma had been partnering, getting the word out about Head Start at a grocery store that was not only accepting SNAP, but also participating in the Healthy Incentives program in SNAP, which provides some extra dollars when those shoppers are buying fruits and vegetables, and found that a good way to get the word out. Similarly, I was part of a discussion recently in Massachusetts, and I understand that the Massachusetts SNAP agency, DTA, had partnered with the Early Education Agency, and that the SNAP agency was including in some of its notices and mailings to its SNAP clients information about this new opportunity for the potential for eligibility for Head Start. So I'm sure that you have many more, examples, and that people on this call have been, I'm sure, busily working, generating even more. And we would be delighted to hear about more of them, and we'd be delighted to, continue to lift them up with you. And I think with next slide that's all we had. There are a lot of ways to keep connected with us, but again, we're just so appreciative of everything that you do at the association, but also the people on this call do every day for people.
Thank you, Ellen. Courtney, let's go back one slide to the partnership slide again. Yeah, so let's answer some questions, and I'm going to go over some things that are in the chat around again, verifying eligibility. Obviously, that's one of the big hot topics here. I want to note a few things that are in the chat that were very notable. So I knew this, but Paula Brown, who is the collaboration director for Head Start in Oklahoma, she's working on with their state SNAP agency to give programs access to the SNAP database. Obviously, again, privacy protected, but that would allow any program to look up, is that family still active? I know this question of, is the family still active? Is that card still valid? Has come up. A lot of our state associations are working on such agreements. We're really excited to see the progress that they've been making. And Paula, thank you for sharing that here. I also saw Emily Snow wrote that families can take a picture of the portal or get a printout. They also have a form that parents can sign, giving them permission to ask their local office to confirm. Emily, thank you. That's another great example. And we will be sure to capture these creative and leadership examples when we follow up this call. Angela Knighton mentioned they can call the number on the back of their card with their PIN while in the presence of staff and see if there's been a current benefit added or recent benefit added. That's another creative way, I think, to prove and assuage any concerns, that you did your due diligence and that those families are eligible. I did want to make sure to address something else that's come up around, it looks like, Ellen, a lot of times SNAP eligibility might be for 6 months or some frequency of time. As Keisha outlined to me, and I'll turn it to her in a minute, right? Again, for Head Start, that doesn't matter. If they're eligible at the point in time, they're not redetermined for any number of years, right? So all that matters is the family can walk through that SNAP eligibility portal at the time. Keisha, I'm going to turn it to you and see if you have any other clarifications to share on the redetermination issue.
Great. Thank you, Ken. I actually think that you covered exactly what I would definitely say in this case, that if a family comes in and they do an intake, and at the time they're presenting this information for, their public assistance, which they're using SNAP, I believe that at that time, that is what is accepted. If their child's in the program, 6 months from now, you would not go back and say, hey, where is your SNAP eligibility at this time? So I also saw some regarding income, and I think I did put some information in the chat regarding the income piece as well, Ken. Thank you.
Yeah, let's actually, if you want to stay on camera, let's turn to that one. The question was really around, Head Start places that priority on serving the most vulnerable families. What I really wanted Ellen to cover here, and she did so well, is all of these families are vulnerable. Now, as Keisha will, I'll turn it to you here, Keisha. Certainly there may be other considerations. You want to, as that family gets on your waiting list or has the potential for a slot, there may be things you want to explore. But Keisha, that should be driven by the community needs assessment, right? Not any unique
Yes,
SNAP
the
issue,
community
correct?
assessment. Yes, the community needs assessment. Every program will be different. We did provide an example of a program and how they implemented the SNAP toolkit, the SNAP eligibility within the toolkit. And there's an example of their selection criteria there.
Yeah, and I think again, the main point is here, you don't need to collect more SNAP specific information. And you know, every family on SNAP needs Head Start. The Office of Head Start has said that. So again, as Keisha said, if there's community needs that you want to explore, those are independent of this portal, this decision. Certainly that can continue to frame your ranking and your prioritization of families.
Thank you, Ken. I do want to bring up also that the recording of the webinar has a really great opening from the Deputy Director of NHSA, Tommy Sheridan, who goes through some of these questions. And so I think it's really great address to review. And one of the things that stuck with me from his address is accepting the card, hard stop, and that's something that I've kind of adopted in my talk about the acceptance of the card, and just remembering that it is about the simplification, as you mentioned earlier. So thank you.
Yeah. Well, I think we're going to end screen sharing here and just remain in our room here. Ellen, are there other things that are coming up for you that you want to share with the audience? And I'd also pitch to our audience and say, please continue to put your questions in the chat and we'll continue to answer them.
No, I think, again, it's not on the Head Start side, but there is going to be a very impactful change in many family circumstances when the pandemic health declaration from HHS ends. Now, that's not going to end. The earliest it would end, we believe, would be sometime after July, and I don't believe that we're going to see it then. I'm just, I don't have any formal information, but when it ends, which, could be in some matter of months, almost all SNAP households are going to lose $82 a person a month.
Wow.
So in a Head Start house, in a SNAP household that would have Head Start children, you're probably talking at least a household of 2 to 3. And they're going to lose 82 times however many are in that household.
Yeah.
That is a lot of grocery money that is going to disappear. And so, I think you're going to see even tougher times coming for a lot of families. I'm sure many of your Head Start already enrolled families are in SNAP.
Yeah.
I'm sure. So it's going to be tougher times. Your program is going to be needed more than ever.
That's really important for folks on the call to know, because they're so tailored to what families need and anticipating that change. We'll keep in touch with FRAC about that change and how programs can help blunt some of that through their budgetary decisions, their programmatic decisions, their partnerships. So I really appreciate you raising that. I am not seeing any other questions in the chat right now. I think we've covered a ton of ground. And if we could go ahead and just thank Ellen again. Ellen, thank you so much for your expertise today and for all that FRAC does. Also want to thank and shout out to Jerry as well. And the whole team. There's other people at FRAC who partnered with NHSA and want to recognize their contributions as well. We're so honored to be able to partner with such a high quality an excellent organization who cares as much about kids and families as we do. And so again, just appreciate all this expertise today. I'm really, really thankful for that. And then finally, I want to thank all of you for joining this call. Wonderful engagement on the chat, really excellent questions to help us make this the most valuable it could be for you. A few closing notes. We will share the slides. We will share the recording. We usually post that on YouTube for easy access as well. If you want to share it with partners. And we're going to share some of these creative leadership ideas in the chat because you all are helping us understand how you're navigating this important new change and doing it with creativity and with professionalism. So really appreciate all that. Ellen, thank you again, and enjoyed our time with you today. Thank you so much.
Thank you so much.
Yeah. All right, thanks so much. Thank you, Keisha. Thank you, Head Start community.